Good morning, everybody, and thank you very much for joining us today. You're very welcome on this latest Policy and Practice webinar, which is about recapping on the major benefit changes that have happened as a result of coronavirus. And it's great to see so many people. It's a very popular webinar. So thank you very much for joining us today. Okay, so I think before we kick off and I introduce our speakers, I'd just like to do a little bit of housekeeping. Using the panel on the right-hand side, if you could give me a quick audio check, please, by raising your digital hand, that would be very welcome. And also in the same panel, you can also ask questions, which we encourage you to do throughout the webinar. We will have polls and a survey at the end of the webinar, so nice and interactive, but do keep your questions coming in the panel throughout the webinar. We aim to be finished by 11:30, but we may run over slightly depending how many questions we do get. We're keen to make sure that our policy experts answer everybody today, and the slides and the recording will follow you. Will follow the webinar later on today. We shouldn't be interrupted, unlike our new Shadow Chancellor, Annalise Dodds, but if we are, I do hope you'll forgive us in these working from home situations. Great. Thank you very much, everybody. It's great to see the interaction going. Okay, so without further ado, I'd like to just introduce you to today's speakers and get them to say hello, so you can put the face to the voice. So Zoe Charlesworth, our Head of Policy at Policy and Practice. Would you like to say hello, Zoe?
Yeah, good morning, everybody.
Thanks, Zoe. Louise Murphy, Senior Policy and Data Analyst from Policy and Practice. Louise, do you want to say hello?
Hi there.
Hi, Louise, thank you. And Peter Carter, Business Account Manager for Policy and Practice. Do you want to say hello, Peter?
Yeah, good morning, everybody. Great to see so many people joining us this morning.
Lovely, thanks very much, Peter. And just also to talk a little bit about, by way of introduction, we do know, obviously, that we're all living in unprecedented times, and it's thanks to the organisations like you that we will get through. So I just want to start today's webinar by saying thank you very much on behalf of Policy and Practice. Thank you very much for the work that you're doing. By way of quick introduction, if you've not heard of Policy and Practice before, we help organisations to give the best support that you can to help people on their way. We know life is very tough at the moment for all of you, dealing with all of the pressure that you are. So I'd just like to say that we're very much here to help you, and we will do that in any way that we can. So today's agenda, what we're going to be covering today is the policy measures that have been put in place to protect people. And Zoe is going to do a comprehensive walkthrough of what these are, and also what the impact of the COVID-19 welfare measures are. And then Louise is going to take us through some of the main concerns that we've had through from people because of all of the responses that we've been giving. And then Peter's going to talk a little bit about how organisations are responding to these pressures. And like I said, we're going to have plenty of time for question and answers today. Okay, so without further ado, I'm now going to hand over to Zoe. Over to you, Zoe.
Hi, Janet. Thanks. I'd just like to reiterate what Janet said. Thank you all so much for joining us. We are very aware of the difficulties, not just for the people who are facing huge income shocks that you're helping, but also the pressure this is putting on organisations, local authorities, housing associations, advice agencies. You must be seeing huge demand. I can't imagine what life's like for you at the moment. So thank you so much for finding the time to join us today. In this session, I'm going to be looking at the measures that have been introduced to ease the income shock due to COVID-19. Some of you sent in questions beforehand. Thanks so much for those. And we are attempting to make sure most of those are covered throughout this webinar. We don't have all the answers. We've drawn together the most up-to-date information, which is on our web pages. Some of you on the front line have been so helpful in, if you've heard about things that are just not in the public domain, to let us know ahead of time. Thank you so much for that, and please do continue to share any information. I think we're all going to benefit by sharing through this time, because things are changing. They're changing day to day. There's better advice, better guidance through time. So the more we share about this, the better. The illustration you can see now is our webpage. Some of you will have seen this. And you might have all gone through similar situations we did. We started by giving people a list of the measures that are in place, or the changes, which you can see on the right-hand side here. We then realised that the questions we were getting were way more situational than that. It was about the interaction of these benefits. So we then created situational sections on the left-hand side. Today, I'm going to be going mostly through the right. I'll be doing a quick, brief overview of these, not in as much detail as is on our pages. So if you feel I'm just skirting around something, you can have a look at our web pages. They are kept completely up to date on the latest advice. I haven't got time to go through everything in a lot of detail today. But I also want to talk about how the new benefits interact with the old benefits. My colleague Louise will then go on to the situational issues on the left-hand side based on the queries we're getting at the moment. Thanks, Janet. Let's move on to the first benefit I'm going to look at, which is the job retention scheme. Now, I think that these the new welfare measures that have been introduced very quickly by the government in response to huge concern about what was happening to people's income. The coronavirus job retention scheme, the self-employed income support scheme, they're basically new welfare measures. It's welfare schemes that are running parallel to the welfare schemes that we know. Firstly, we're going to look at both of those. There's much more detail about them on the website, and you'll know as well as I do that the guidance keeps changing on these. The big change with these new welfare schemes is that the power doesn't lie with the claimant. The claimant cannot apply for these schemes. For the job retention scheme, it's the employer who applies. And for the self-employed, the HMRC identifies from previous records who is likely to be eligible. Huge change. They're almost, and because they're almost flat rate, no means testing, it's much more like a universal basic income. So let's look first at the job retention scheme for employees. I think most people probably know the main details of this. It's the employee was with on the 28th of February, as long as you were paid through PAYE and had a UK bank account. And the grant is for up to 80% of the salary, up to a maximum of 2,500. And there's different rules about how you work this out for salaried employees or those whose income changes. And I see that more as those who are paid by the hour or pro rata pay, and those who have a salary contract. If somebody, and of course this scheme introduced that word furlough, we all know now, but if somebody is furloughed, they've agreed, the employer has informed them in writing, they've agreed to take this grant to be furloughed, it's got to last for at least 3 weeks. And the employer will make the claim. The employer will make the claim through HMRC. I think there's quite a lot of flexibility looking at the guidance to employers on how they claim. It will be audited later, some will be audited, but in general, there's a lot of trust in employers at this stage to claim correctly. Can we just move on to the next one, Janet? Is that okay? So in the next slide, I'm just brought out some of the main clarifications that we've had since the introduction of this scheme. Initially, there was a lot of confusion. The bare bones were put out there into the public domain. A lot of questions asked, and this highlights some of the areas that we've had further clarification on as time's gone along. The calculation of what can be included and not included from the employer's side. There's been, I think that this statement that is based on what the employer is obliged to say, pay, basically underlines it. So although specific guidance has been given around tips not being included, commission, unless it's in the contract, I think this sentence will be the one that it's judged on. So if it's in somebody's contract that they'll get paid on an hourly rate, but they have to do some overtime every second week or something, I imagine that will be included. We will, if we hear any more, we will be updating this. It's also been clarified that if those have moved to another job or made redundant, can before the 28th of February can be rehired. Sorry, after the 28th of February, they can be rehired. And I think this is really important because a lot of companies had a knee-jerk reaction to the economic situation with COVID-19 to shut down. And this sort of gives them an option to reopening again and taking back those employees who they're placed on unpaid leave. Furloughed people can work for others. as well. That's been clarified. There was lots of employment contract issues there. So they have to make sure it doesn't step on their current contract. The most useful clarification, I think, is that those furloughing can include those who can't work because of vulnerability. And I think this is defined as those who got the NHS letter, the 1.5 million who are advised not to leave their houses, or if they're caring for others, such as childcare. And I think this is really useful because it gives a guide to the public sector if they have employees in this situation. And I think the other issue that has been clarified further is it does apply to those on 0-hour contracts. It does apply to directors paying themselves through PAYE. And I think most important to advice agencies, it does apply to those with no recourse to public funds and students. And we'll come back to why that's important a bit later on. The second new welfare benefit is the self-employed income support scheme. And this relies on having completed a self-assessment form as a self-employed person in 2018-19, and that was extended for those who had been late in getting that form in. I think the deadline was last October, but they've extended that end of April so that those who were late putting in their self-assessment forms are not penalised. You must have had trading profits of less than 50,000 in 2018 or over the last 3 years, and made up half your taxable income must have come from self-employment. And again, this very similar measure, 80% of trading profit or up to 2,500 a month. And again, not like any benefit system we're used to, not means tested. And HMRC will invite claimants to apply. They can't make the application. And once they'll be invited to apply, and they'll be pointed towards online form. The grant will be paid as a lump sum, and this starts becoming interesting about how it interacts with other benefits. It will count as normal business income for tax credit and UC purposes. And obviously from that, things like surplus earnings come into play, and we'll be talking about that a bit further on. Oh, I've just got a slide here that there is other help for self-employed households. I'm not going to go into these, they're more business and welfare orientated, but just we have been advising people to look into these as well, just to make sure that they know they're out there. If we come to the benefit systems we're more used to, the means tested benefit systems, there were changes introduced from April 2020. Universal credit and tax credits were increased by £20 a week. No change to IS, ESA or JSA except the standard uprating at 1.7% or thereabouts. To help private renters, the local housing allowance has been increased to align with the 30th percentile of local rents. Now, the impact of this will depend on your area. We did some analysis to look at the change because of this measure. In some areas, it's £5, £9 a month. In other areas, it's a few hundred a month. So we have done some analysis on averages across England, which is very interesting. And, you know, if you want to see that, let me know. But it really does come down to your local area. To support the self-employed, the minimum income floor has been got rid of for 12 months and will be based on actual income. So it's a bit of a relief to those who are self-employed and on UC anyway, but it does mean there will be support for those self-employed who are newly accessing benefits. And there's also been some very important rules about tax credit hours. So as you know that, you may know that if tax credit, the hours that you need to be working in order to access tax credits, if they reduced for more than 4 weeks in a row, you had to inform tax credit, you might well move to different benefits. That's now been extended to 8 weeks. And similarly, the extension to 8 weeks about whether the self-employed business is a valid self-employed business. So changes in income, reductions in income due to COVID are sort of being ignored for 8 weeks, and people can stay on tax credits. We expect that 8 weeks to be extended. As soon as we know it is, we'll be putting it on our website. Alongside these, there's additional changes. DWP overpayment recovery suspended. Now, I think from looking at the documents from the DWP about this, it looks like they needed to move huge numbers of their staff to frontline work. And I think this has just been this is done to help claimants, obviously, but it's also to help the DWP to provide the initial response to claims that's been required. This doesn't include advances, which will carry on being recovered, and it doesn't include rent arrears. And I think it's important to notice that council tax overpayments are still being recovered. There's huge difference between local authorities out there. The government has urged them to not be recovering, but we do know some are still quite actively recovering council tax arrears. There's been changes to the universal credit claim procedure. Everything's online or by telephone. Now, DWP, I think, have done an absolutely incredible job managing to take all these claims. I gave a person advice to just hold on. They needed an answer to a question, to hold on in that queue of tens of thousands ahead of them, and it took 7 hours, but then they got their claim sorted. And I think all we can say to people is be patient. DWP's advice is, if you're claiming, they will get in contact with you. And the usual waiting period for getting in contact has changed. They will be in contact, and they're just saying to people, get that claim in. If you can't get through the verification process, we'll get back to you. Work capability assessments are suspended, sanctions are suspended, and the free school meals has been extended over Easter. Now, we're hearing all different things about free school meals. It does seem to be how well this is being implemented, does seem to be very localised. So, and we'll be keeping an eye on that. There are obviously, you've got two benefit schemes running side by side, and there are obviously going to be gaps in this provision. There is a lot of concern for people out there they don't meet the new scheme provisions. As we say, these are a lot more generous than the means tested provisions. And there are a lot of people with who just don't, for some reason or other, do not fit into either the employer or the employee scheme. So we're directing to them universal credit and council tax reduction. I think it's really important that we also direct people to free school meals and food vouchers if they apply. These can, if you look at the level of awards under universal credit, these can actually be quite valuable. And we've got to remember that the free school meals is worth £15 a child a week. So it does bump up the household income. Those with no recourse to public funds, and we've found it really difficult to advise these people. They can't claim universal credit, but they are eligible, obviously, for the new welfare scheme, so the self-employed scheme and the job retention scheme, and to some national insurance benefits, such as contributory JSA and ESA. But a lot of them are going to rely on their partner claiming if they've got a partner, but that does mean that their UC will be very, very much reduced because it'll be on a single person entitlement. There have been some measures put in. I do think that we're seeing that the government does recognise that this is a real issue. If they're sick with COVID-19, then get medical support, and they won't be asked their immigration status. And there have been guidelines issued to local authorities to include these people within homelessness provision. I think in general, most people with no recourse to public funds who are facing destitution will be dealt with by the sort of network of third sector organisations out there. If anybody knows any particular central area, a centralised organisation we can direct people to, please share it with us and we'll get it to all the people on this webinar. The other group we're seeing that are falling through these gaps are students without parental support. And this doesn't mean without parental support as in the regulations, in which case they can claim universal credit. This means people whose parents are supposed to be paying part of their living costs, but for some reason or other, or because they're under economic strain themselves, can't. And many of these students have been supporting themselves through working. They are eligible for the self-employed income scheme, and they are eligible for the job retention scheme and contributory benefits. But if those all fall through. They aren't, many of them are not eligible for universal credit. But if they are really facing destitution, we are signposting them towards local authority homelessness support, because they are included in those provisions. But again, there are real problems for some of these students that we're seeing, and I do think the government is beginning to understand those that have fallen through any provision. So situation's fluid at the moment. Let's hope that more comes into, more comes available for these two groups. I love this. This graph is just incredible. Just watch this. It's amazing, isn't it? I mean, I've got this here to just show the impact. I'm going to be running through some of the impacts of some of these new measures. And this is here to show the impact on the DWP. And I think that the flexibility that they have shown has really come as a surprise. They've managed to be very flexible in their approach to the challenges of COVID-19, and to manage to set up this number of new claims, I think is quite extraordinary. So I just think that graph is for us to remember what a job they're doing at the moment. Happy for the next slide, Janet. So let's look at the UC changes. We did some data analysis looking at all the main change to take into account all the changes we've just looked at about the increase in the basic allowances and the LHA and the end of the minimum income floor. And we do think there is going to be an impact of this. This was just looking at admin data of those who are in receipt of UC before the crisis. So, but we did find that the number who could not meet the basic bills from their income fell from 16% to 10%. So that's 6% more households who can keep their head above water, and I think that's really good news. We also found that on average the UC awards increased by about £98 a month, or 7%. Now this might be less than we expected, but this is mostly due to the benefit cap, which we'll be coming on to shortly. Thanks, Janet. So looking at some of the impacts of all these different benefit systems running together. So we've now got three, haven't we? We've got the old legacy systems, we've got universal credit, and we've got these new COVID response welfare benefit systems. So we've got three running together. I'm just going to cover how some of these interact. Firstly, I'm going to talk about, let's have a look at legacy. Sorry, Janet, can you go back? Yeah, I had a slight tickle in my throat there and didn't want to cough live, just so that, because I know it creates terror at the moment. So I muted myself for a while. Sorry about that. Yeah, so legacy against universal credit. In general, people will be better off under universal credit now. There doesn't seem to be any move from the government to introduce these increases in basic allowances to legacy benefits. Many people on legacy benefits won't have the choice of moving over to universal credit, but it does mean that when they do so, the shock might not be so great. I do think that it starts creating, once you end up with all these different benefit systems giving different amounts, it starts being really awkward for welfare advisors in pushing people, pointing people to the right road for them. So I'm not sure this has helped anything. I think it would have been better if it had been applied across the board. But there we are. There is a difference now. Thanks, Janet. Tax credits and universal credit. I'm sure that anybody who's advising benefit claimants now has come up against this. Now, if you were claiming working tax credits and you've got unpaid leave, but you might well be returning to work later, you're not sure, should you be trying to survive on that tax credits that was calculated on your earnings, or should you at this point be making this jump into universal credit? And I really don't think this can be answered unless we look at individual circumstances. So when I've been having these queries, I've been doing some calculations on our calculator. I've been trying to work out what's best for this individual person. And in the end, it's going to have to be their choice. And once they move to universal credit, they can't move back. Some people, it's easier if they've got more than 16,000 savings, they can't move. And also if they need immediate money. If they just, they need money within, they've still got the 5-week wait, but they can get an advance on universal credit. And self-employment, they have to take into account that the minimum income floor may well be introduced after a year and probably will. So there's all sorts of things we need to take into account. The one bit of advice I think we can all agree with is that they've got to inform HMRC that their 2020-21 income is likely to be way lower than the current, the previous year's income, and to make sure that their tax credits are at least taking that into account. I mentioned earlier that we'd come onto the benefit cap, so here we are. Now the benefit cap is having a huge impact on those promised increases in universal credit, particularly private renters and people with children. I think these graphs show you that if you look at the one on the left-hand side, which is outside London, the sort of promised increases are the blue line, and the average actual increases are the orange one. And we see a couple with 2 children in a 3-bedroom property at the LHA will not see any change. And if they've got a 2-bedroom property, they'll only see £11 increase. And inside London, hardly anybody will see an increase. So it's only a couples in a 1-bedroom property that will see an increase. And I think this is, I'm still seeing tweets from the government about everybody will get this increase. And I think we've got to manage expectations for those people who are advising about this, that if they are private rented, they have children, they probably won't get that increase. It will depend on your local area, your LHA. But in general, most people with children and private rented will not be seeing that increase. Thanks, Janet. And I think this creates all sorts of questions. This might be a bit off topic, but I do think it creates all sorts of questions that anyone working in welfare benefits will be asking. First of all, does the benefit cap now meet the initial objective? It was to encourage people to return to work if they could do so, and to create parity between the amount that somebody working had to live on and those on benefits. But now we have so many people accessing this new welfare benefits scheme of 2,000 up to 2,500 a month. I'm thinking it's maybe something that needs revisiting. I also think this question comes into this about what the government thinks is needed to support households. The Treasury is saying 2,500 a month. And the DWP is saying 1,600 outside London and 1,900 in London. These are quite different amounts about what is seen as reasonable for households to be living on. And of course, the benefit cap will have huge impacts on local authorities if it continues. We've got this million new claimants. If you look at the proportion of those who will be benefit capped will be quite large. DHPs at the moment have been plugging that gap. Local authorities are not going to be able to offer to DHPs to everyone who is going to be benefit capped. Welfare support, they have duties under the Children Act to support children. Obviously, the ones affected are households with children. Again, this will have a knock-on effect on local authorities. And we know that whether the LHA is met or not has an impact on homelessness. We did some research with the local government associations showing that there was an absolute link between the two. So again, another impact on local authorities. So we may see this revisited. I do hope so. Thanks, Janet. And I just want to show you some of the impacts of having these two parallel welfare schemes. It does create inequitable welfare support. It's obvious why the government had to do this. There was a lot of worry out there, a lot of immediate concern. Rishi Sunak mentioned that the new schemes are to ensure that business can be ready and up and running straight after this crisis has passed, and to keep people's relationship with their employer going. Lots of good reasons for introducing them. And I think all of us would be grateful that huge amounts of people are supported up to the level of 2,500 a month, rather than the lower means tested benefits. But it's not because it's not targeted or means tested, we end up with some very bizarre situations. So a couple both qualifying for the new schemes could receive 60,000 a year, but a similar couple on universal credit could receive 7,000 a year. That's not just a small difference, that's a huge difference. And I wonder how long this can continue with that sort of generosity that isn't being means tested. Thanks, Janet. Another case study I've got here, we've got Jack and Jill living next door to each other. They're both lone parents with 2 children. They both started their jobs 6 months ago, going back to work when their youngest child could go into start school, and they both earned 30,000 a year. Jack was furloughed and Jill was made redundant. Thanks, Janet. We'll move on to the. So we can see here the difference in income. And again, this isn't a small difference. Jack receives 2,800 a month. He isn't capped because, of course, his furloughed earnings make him exempt from capping. Jill, on the other hand, is capped. So we've got 1,100 difference in their income. And I think this will feel very unfair to people merely because they can't apply to be on the scheme or not. What the employer decides is outside their hands. I mean, I do think in a time of crisis, probably there's all sorts of things we can't control. So for the short term, this might be absolutely acceptable, but one wonders how acceptable this will be in the long term. Thanks, Janet. Oh yeah, this is just showing that the reason for Jill's lower UC is because of the benefit cap, and this is from our calculator, so it just shows her that it also actually quite usefully, it's quite a good demonstration here. There are other things that up the amount you can get under universal credit. So she should be looking at free school meals, make sure she's got her free prescriptions, and her warm home discount. So yeah, it's very useful to see that universal credit is not the be all and end all for people on universal credit. There are other things they can access. One of the other impacts I'd like to bring out, council tax support sits out universal credit, and it's not something that a lot of people in welfare advice think about, but it does. The support for council tax there will be different impacts between different areas. For those who didn't know, the government has given local authorities 500 million in total, and suggest to help support council tax payments, and they've suggested they use it by giving £150 reduction in liability for everybody who's in receipt of benefit, council tax reduction. But obviously the impact this will have will depend on their current scheme. So if we've got a local authority who currently gives people council tax reduction based on 100% of their liability, even if they had non-dependents, this £150 addition would mean they pay no council tax. And it does mean the LA will retain a huge discretionary pot, which it can use to help people who aren't in receipt of CTRS with their council tax bills. But if we have another local authority who expects who expect everybody to pay at least 40% of their council tax charge, even with that £150 discount, the claimant is still having to pay £27.50 a month. So this is a real difference just because of local authority boundaries. It also means that that local authority will have little discretionary support left to support people, even though they're likely to have more people who need support as they're still having a charge each month. And I think for welfare organisations, it really comes down to understanding the impact in your local area. Thanks, Janet. And my final slide before we pass it to Louise to go through some of the questions we've been having from members of the public is around surplus earnings. I'm putting this in there for those of you who've asked me to cover it. But it's really funny, isn't it? All of us who work in welfare advice, we knew these regulations off by heart when they first came in, got our head around them because they're the most complex regulations I've seen. Then we ignored them because they kept putting up the threshold, so it never really applied. And now we've got to dust off those regulations and go through them again. I've got an example here of a self-employed person who accessed the self-employed income scheme. So in the months they're waiting for the grant, we can see March, April and May, they get £1,000 universal credit. And in June, they get their grant of £7,500. The first part of surplus earnings is to work out the nil UC threshold. Won't go into the mechanics of this, but for this person, it's £3,130 a month. Now, this is very large at the moment because we've got a de minimis of £2,500. So actually, the impact of surplus earnings is not as bad as people fear, merely because we've still got that very, very large de minimis amount in the regulations. So in July, the person doesn't receive any universal credit, and in August, a reduced one, and returning to their normal amount in September. And I think it's worth remembering that without the grant, they would have received over these 7 months, £7,000, £1,000 a month of universal credit. But actually, they've received 12,100. So although they're not getting the full grant of 7,500, some of it's been taken away, they're still 5,100 better off. So even though the self-employed won't realise the full value of the grant, it's still worth them having. There are certainly implications for those working in welfare around this. First of all, how do you give advice? How do you explain to people that when they get that grant, that they've got to just use it to live on probably for the next couple of months? And how many months they need it to live on will all depend on their nil UC threshold. And that's a really difficult message to get out, isn't it? I mean, how do you say to somebody, put that money aside because it's actually going to be used for the next couple of months? And I think it's really important to let people know that they were actually still better off by getting it. And implications for the claimant, they need to keep that claim alive. This person needed to know to reclaim in August. Our benefit calculator for those out there who are using it does give you this nil UC threshold amount, so you can actually give very quick advice to people about when they've got to reopen that claim. I would say if you haven't got the time, and you won't have the time at the moment to be working this out individually for each claimant, make sure that they keep opening their claim each month so that they can get back onto universal credit as soon as possible and don't end up with too large a gap where they miss some months of payment. Lastly, just before I finish off, we went through at the beginning about how fluid the situation is at the moment. Every day I'm seeing new advice or new changes, and I'm sure you're all in the same situation. And I just want to look forward rather than looking at how we're dealing with the current situation. What's going to happen after 3 months when these 2 new welfare schemes run out? The government has a choice of extending these schemes, but this retains the duality of the welfare provision. I don't know if that's a problem. For short-term, people know we're in an extraordinary situation, but it's certainly something they'll have to consider. And it is a very simple method to support millions of workers without overburdening DWP. And if they end the grants scheme, will that money that was in those new schemes be put back into UC to make UC even more generous? Could the DWP cope with the influx of new cases? And if they end the grant scheme without increasing UC, what are the implications for local authorities' financial resources in plugging the gaps that they've always done? We've all known that how the welfare systems stood before COVID-19. Local authorities are utterly crucial, and the amount of effort put in by housing associations to support their tenants. These organisations are utterly crucial in plugging those gaps. But if they have to plug those gaps for 1 million more people, is that going to be possible? So just leaving those hanging in the air. And over to my colleague Louise.
Actually, that's brilliant, Zoe. Thank you very much. Just before we pass over to Louise, I just want to do a quick poll, if I may, and I'm sure that everybody's got lots and lots of benefits related questions for Zoe. So again, just a reminder to put those questions in the panel, and we on your right hand side, and we'll get to them shortly at the end of the webinar. Sorry, but just let me pick the poll and launch that on the screen for you now. We're very interested in your thoughts on this question. So before we move over to Louise, what in your organisation, what are your immediate concerns, or what is your one immediate concern? Sorry, I can only give you one answer. So I have a range of options for you to choose from. And as we always do these polls, I do appreciate it. There may well be a combination, but if you could choose your main one. So is your immediate concern that there is too much for your demand for your services right now? Is your main concern that you have uncertainty over the future demand of your services, as Zoe was talking about there? Are you concerned primarily that you're not reaching the most vulnerable people? Are you concerned that your organisation is a bit slow in getting support to people that need it? Or is your main concern that you don't have enough information or guidance to give to people? Thank you very much, everybody, for taking the time to do the poll. Lots of options and answers coming in. I think there's a huge amount that Zoe has covered there, but we're very interested to hear from you what your own experiences are. So I'll just leave it for a couple of seconds longer to make sure that everybody has a chance to vote. That's fantastic. So let me close the poll now and then share it on your screen so that our panelists can talk about them. Zoe, any comments on the answers there? So what we seem to have is 47% of people say that not reaching the most vulnerable people is the #1 concern at the moment. Can you see those on your screen, Zoe? Any comments there?
Yeah, I can, and I think that's the immediate problem at the moment, isn't it? Is that for everybody whose job is out there is to support others. I think this is an absolute concern. We're getting a lot of queries. You're getting a lot of queries. A lot of people are very articulate and able to access what they need. There's a huge number of people that we know this from before COVID-19, huge number of people who have real difficulty accessing benefits, especially now we've got people isolating, a lot of vulnerability out there, a lot of anxiety out there. And I think that this ability to reach out to vulnerable people is absolutely crucial. For local authorities, it's easier because they have the data, and Peter will be covering that later, that they can find those vulnerable people. Housing associations have, and local authority housing departments have a very, very good knowledge of their tenants. But there's a lot of people out there who are slipping under the radar, and I can actually see that this is a major concern.
Thanks, Zoe. Peter, do you have anything to add to that?
I think it's very interesting response actually that people have put in there. I think the conversations I've been having since the lockdown on the 23rd of March has been the huge change that organisations have had to face, and they've been very reactive. The answer to me seems to suggest that people are starting to think about being proactive and reaching out to vulnerable people, defining who those different groups are and who those vulnerable people are, and saying how do we reach out to them. And yes, I will be covering that, as Zoe just intimated a little later, in terms of how some of the people who are using some of our services are managing to do that. But I think actually all the answers are very valid, and given the number of people on the webinar, everything is in play there, isn't it? You know, too much demand for the services, 12%. I mean, that's quite a lot of people are saying, you know, they're really inundated with requests for support, and I think the challenges are there for all of us at the moment.
Brilliant, thank you very much. And like I say, just a reminder to everybody to get the questions coming in. Let me close that poll now, and then we can move on over to yourself, Louise. Over to you.
Thanks, Janet. Yeah, so as Zoe mentioned, I'll just be sort of going through some of the common queries that we've been getting through our website, and we've also got a help chat on our benefit calculator. So we've been kind of seeing the sort of trends of the main concerns that people are having. And I think Zoe's obviously covered most of the kind of the content, how the schemes work. So trying to maybe just, as she said, cover the more like situational side of things. So the first one, and what basically a really common kind of theme, is just people wondering how the job retention scheme actually works. And I think the core kind of worry is that it's very different to benefits or kind of other support that people are used to, and that the power lies with the employer. So we've just had a lot of people who are feeling very confused and powerless, because even if they've read up about it, they know exactly what it is, actually the ball's not in their court, and there's a limit to how much they can do. And I guess it'd be interesting at the end when we have the Q&A how that's sort of affecting you if you do work in welfare rights, because I guess it's a fairly different thing. You know, you can't go through an application with someone really. It's something for the employer to do. But I guess a few bits of you know, advice that we are able to give is, First, that the employer must confirm in writing if an employee has been furloughed. They have to do this before they can claim the grant from the government, so that has to happen in good time. And you know, the employee must agree. They can't be forced to go on furlough. Although the employer, you know, obviously has to be involved, it is something that you know, they have to come to a mutual agreement over. And then just this point at the bottom is, you know, we've had people who are worried that their employer isn't kind of, you know, doing the right thing, that they're not getting what they're entitled to. And that, I'm sure, can be a really worrying thing, because as we've kind of said, that they might feel pretty powerless in that situation. And what sort of we've seen in the official government guidance is that this is a matter to take up with the advisory conciliation and arbitration service, and they can deal with these more sort of employment law matters. And then a few more just like questions about the technicalities of the retention scheme. As Zoe mentioned, to be eligible to be placed on furlough, you have to be on your employer's PAYE payroll on the 28th of February. So if you started a new job after that date, your new employer isn't able to put you on the job retention scheme. However, it is possible if you were employed kind of with a different employer on that date, you can be re-employed and placed on furlough. This has now been kind of made crystal clear in the government guidance. I guess though there is a question about kind of, will this happen much in practice? Again, I think it'd be interesting if any of you have kind of, you know, kind of anecdotes from the front line if this is happening, because, you know, I think we've had a lot of comments from people saying, I know that this is technically possible, but there is no way that my old employer is going to do this. And since the decision does rest with the old employer, it's a bit of a tricky situation where we can say, you know, it's possible, but we can't guarantee that they're actually going to do it. The second question about 0 hours contracts, I guess that's a fairly simple answer, that yes, as long as you're on a PAYE payroll, you will be eligible, even if you're on a 0 hours contract, an agency worker, an apprentice, any of these groups, you should still be eligible. The third question we've had is just sort of people wondering, I think Zoe covered this off a bit, you know, what is this 80% based on? You know, from what we've read, it's 80% of the gross wage, and then tax, national insurance, student loan repayments and pension contributions will be deducted as normal. And then things like commission or overtime, as Zoe said, these will be included if it's included in the contract. So it's really a case of going back to that contract and seeing what that says. And then finally, a question about kind of working more than one job and how that works. And basically what the guidance says is that the job retention scheme applies to each job separately. So if you've been furloughed by one employer, that doesn't prevent you from working a second or a third job. But the thing to bear in mind is that many employment contracts prevent people from doing this. So even if the job retention scheme doesn't stop you, there might be other things which come in the way of that. So that's something to bear in mind before encouraging people to start another job. So a second question that we've been getting quite a lot recently is from people who are shielding. So these are people with underlying health conditions who have been encouraged by the government to stay at home for at least 12 weeks, and they're not sure what support is out there for them. I think some of the confusion seems to come from these new words that are being thrown around, you know, shielding, self-isolating, social distancing, and not kind of being sure what applies to each different group. And basically the bottom line for these people is that as it stands at the moment, they won't be eligible for statutory sick pay or contributory benefits, so new style ESA, since these only apply to people who are self-isolating due to suspected coronavirus in the household. So that's people who are staying at home for the 7 or the 14 days. These people will be eligible for the job retention scheme if they're in employment and their employer agrees. I think Zoe mentioned this earlier. This was one of the clarifications that came out recently, which has been really helpful to say that, you know, even if this person's workplace is still open, there's still work for them to do. They can be put on furlough if they have an underlying health condition, or indeed if they've got children and they need to stay at home to look after them. They can be placed on furlough if their employer agrees. And then finally at the bottom, if that's not possible for whatever reason, then kind of as ever, we're encouraging people to check if they're eligible for universal credit, council tax support, and free school meals, since that it might be out there. Another question sort of touching on the policy change that Zoe mentioned earlier is from people who are on legacy benefits, often on working tax credits, who are a bit concerned that the changes that they're going through at the moment will force them onto universal credit, and they're kind of worried about this change and not sure what that will mean for their income. So I guess just to reiterate what Zoe said earlier, that the HMRC have announced that temporary changes to working hours due to coronavirus will be ignored for at least the next 8 weeks, likely a bit longer than that. So basically, if you've got a temporary change, you're not working as much as usual because of coronavirus, that'll be ignored. You can still receive your tax credits as normal based on your old working hours. Likewise, if you're self-employed and you temporarily reduce your hours or stop trading, this will be ignored. If this is a permanent change, so you've been redundant, you will need to inform HMRC, and this may well trigger a move to universal credit. And like Zoe said, although this is ignored, people should still inform HMRC so that their future tax credits are based on this lower income. I guess then the point at the bottom is that for people in this situation, it might actually be better off to move to universal credit. Zoe was showing the impact of these, the measures, meaning that actually people might be better off. But really this will vary depending on each household. So basically you'll need to do a benefit check to see what it's like for each household. And there are obviously the things to bear in mind, like the 5-week wait. Obviously this is a difficult time for people, and maybe going that 5 weeks just isn't even a possibility at the moment. There are also features of universal credit to keep in mind. So for example, the minimum income floor, even though it's been suspended for the time being, if that's introduced again in the future, what will the impact of that be for self-employed people? And then just, sorry, I missed that point in the middle about council tax support. Just if people aren't claiming that, they can make a claim for council tax support, and that won't force them to move to universal credit. So another kind of common theme, a bit like the one we covered earlier, just about the mechanics of the job retention scheme, is people wondering about the self-employment scheme, and a lot of people saying, I actually don't think I qualify, I don't fit into the categories. What can I claim? And it is right. We've been hearing from quite a lot of people who, for whatever reason, won't be eligible for the scheme. So that might be people who are self-employed, but they're also in regular employment, and this regular employment makes up more than half of their taxable income. Some people with profits over £50,000, although I'm guessing that those are maybe not the people that are, you're interacting on the front line with as much. And then finally, people who are self-employed now but weren't self-employed in the 2018-19 tax year. And we've certainly been hearing a lot from those people who basically are pretty worried about kind of what's out there for them. So unfortunately, unlike people who are in regular employment, self-employed people aren't eligible for new style JSA by and large, because they won't have been paying Class 1 national insurance contributions. This is different to new style ESA, so I think it's just important to remember the distinction that if someone's self-employed and is too ill to work, they should be eligible for new style ESA, since it's out there for both employed and self-employed people. But new style JSA is more specific. It's only for people who've been in regular employment and paying Class 1 national insurance contributions. So then really these people, if they can't get the self-employment scheme, we're sort of pointing them to the means tested benefits, universal credit, council tax support, and as Zoe mentioned, there are other kind of pots of money out there, for example business interruption loans that people might be able to get support from. And then finally, we're just hearing from people who for whatever reason don't qualify for any support, or at least the main types of support, and this is really difficult. Sort of Zoe mentioned this, that we're not really able to point them to any of the the main benefits. The two big groups are people without recourse to public funds and students who don't have parental support. I guess first of all, if these people have been in employment or self-employment, they are still eligible for the job retention scheme and the income support scheme if they meet all the other criteria. So these schemes don't count as public funds. So if these people have been in employment or self-employment, definitely point them towards these. Also, contributory benefits based on national insurance contributions, so New Style, GSA and ESA, do still apply to these groups. But really, if they can't apply to either of these, it is quite a tricky situation. If they have a partner, things might be a little bit easier. So students can be eligible for universal credit if their partner is eligible, and people with no recourse to public funds, again, their partner can be eligible, but only based on a single person needs allowance. So, you know, it's better than nothing, but it's not a huge amount of money to live on. Another important thing to bear in mind is that kind of just as of this week of the new financial year, the prescribed regulations for council tax support have changed. So that means that EEA nationals now need settled status to be able to claim CTS. This is making basically CTS even stricter than DWP benefits. So, you know, that's, I think, something that's maybe kind of slipped in without too much attention. So that's sort of just important to bear in mind if people are kind of looking for all the support that's out there. So then finally, if people can't get any of these kind of types of help, what we're really saying is to look to local authorities. They might be able to help. They can at least clarify, as Zoe said, that you can get medical care if you're ill. They can get local authority homelessness support, and they might be able to signpost to local charities and mutual aid groups who, you know, at least in the short term, might be able to give support that helps these people stay afloat. And I think that's everything. Those are the sort of main questions. But as I said, when we get to the question and answer session, it'll be really interesting to hear if those resonate with you, if those are similar questions that you've been hearing, and if not, if there are any other kind of main themes.
Brilliant, Louise. Thank you very much. Without further ado, I'm going to hand right over to Peter Carter. Over to you, Peter.
Hi, good morning, everybody again. Very quickly, I'm just going to run through. I'm very aware of the time. We can just move on to the first slide then, please, Janet. This little section. I think one of the things that came out in terms of the poll earlier on was the importance of trying to contact the people who are vulnerable, but who are the vulnerable? You know, how do we know who they are? Local authorities and most of us are very aware of who is in the bottom left-hand section of this Venn diagram, people who we know are vulnerable. Introducing to this are the newly vulnerable, the people impacted financially by the latest pandemic, and of course people who are shielding. So how do we contact those people? Okay, thanks. Yeah. And one of the things we're trying to help people do is to identify who those people are, help you to engage with them in the right way, and then track maybe how the interventions that you bring into play are going to be, how effective they are and how they move forward. Something maybe for the future. But certainly, how do we identify who they are? And we're doing various bits of analysis based on household level data from local authorities in terms of identifying who those households are. So here we can see the bit of data, we've demonstration data, but from a local authority area in terms of how many households are being impacted in different ways. And we want to provide support in the right ways. And we're able to drill into these, not just these large numbers of figures. So 2023 couples with school-aged children, are they getting their free school meals? But actually ultimately being able to drill into exactly who those households are. Low earners with self-employed and so on. And we can drill into those different households in key ways here, which is around being able to look at people from their financial position of financial resilience, looking at how they're being impacted by universal credit, and very importantly, making sure that, as we've been really fundamentally saying on this webinar, about making sure people are maximising their benefit take-up screens. And here we can see on this particular screen, there's over 34,000 households in the cohort from this particular local authority area. We don't want to provide the same uniform support for each of those households. There's different groups of people who are going to require different support. And if we just move on, we can see how we can start drilling into these areas by selecting these areas. So here we got financial resilience. We're looking at those households, for example, who are already in rent arrears. Households with specific ages of children. You see in the top center there, 724 households, because we've done some filtering. we've got down to 724. In the bottom right-hand corner of the screen there, we can see specific details of an individual household. If we go to the next screen, Janet, we're able to see more details about that household. So in this particular household, we've been able to track the changes over a period of time. From 2016, it's a couple with 5 children. You start seeing that their work has gone in the box in the center there from 37 hours to 25 hours working a week. So they've been significantly impacted. And because of the analysis we do, we can start saying what kind of specific support should this household be getting. So they should be maybe eligible for free food vouchers, free NHS prescriptions, and so on. You can see the list there on the bottom right. So we're able to point people in specific directions and start doing that. So if that's just something of interest, then that's kind of support we're able to provide fairly quickly at the moment to local authorities who are interested in having a single source to find out who those vulnerable people are. Next slide, Jan. One of the areas Zoe's talked about and Louise talked about is the calculator. This is just a screen from the calculator where we can start saying, we can put your current situation into the calculator. We can sort of tell you what benefit maximization you should be getting, what you should be receiving in benefits, and we can break those down. There's a very high level view of how housing benefits have been calculated. So people are still being impacted by under occupancy rules, for example, in this instance. If we move on to the next slide, Janet, we can start looking at saying not just that, but if people should move on to universal credit. Here I've got an example of where somebody will be worse off moving into universal credit. So specific examples for specific households, but we're able to see what will be the impact. So if people are thinking about changing the system, then again, customized support in the calculator for doing that. If we move on to the next slide, Janet, because I'm racing through this, we're able to, if you look on the right-hand panel of this screen, you can see current situation, scenario 1, scenario 2. I just put some random numbers into here to show that we can say, what is your current situation and what will happen if? Well, that might be what will happen if you have a life-changing event like a child is born, or if you lose your work, or if you change various things you're trying to achieve, then you can do various things on all of that. But here we've got a situation where we can look at how we can create scenarios to show people what will be the impact of the changes they're currently facing. Move on to the next slide, Janet. And fundamentally, for a lot of people, we're able to build this into your website, so we can have it so it's a self-serve. So here we've got it, you can see it's for Vivid, so a housing association. And on the top right-hand side there, we can see Send to Advisor. This is a self-serve screen built into their website. So if you're looking to provide support for your residents, your householders, or your clients, you can build this into your website very simply to be able to provide support for people so they can contact you with specific areas of concern. Next slide, Janet. And again, as another screen that Zoe was showing earlier on, so a little bit of duplication there, where we can see the kind of standard support, standard advice you can give in terms of what kind of areas where people could get support in their areas. Just before we go into the question and answer time, just very quickly say that there's about 1,000 people registered for this website. We're a small organization. If any of what we talked about is of interest to you and you've got specific questions or would like to know more about the way in which we can point you to the most vulnerable or point you to a way in which the calculator can support your organization, please ask us. We'll prioritize our response to you in doing that. We'd love to work with you. We'd love to support you, and we'd love to provide more advice to you. So again, point you to the web page that Zoe mentioned at the very outset, which is on our website, policyandpractice.co.uk, where we're providing all that background support in terms of how you can deal with what kind of questions you've got around the changes. But if you've got specific areas of concern around this, then please let us know and highlight that. We will prioritize getting back to you as soon as we can. Janet, I think we're moving on to the question and answer section now.
We are indeed. Thank you very much, Peter. So yes, let me move on now. First up, thank you everybody for the huge number of questions that have come in. I will do my very best to get through them. But if I can start, I think this one is from a citizens advice organisation. Great to have so many citizens advice on the webinar today. Possibly one for yourself, Zoe, in terms of the policy. How up to date is this advice that you've given today?
We try to keep it completely up to date, so we're scouring continually. The advice on the website, we're scouring continually for any new information that might have been released by the government, new clarification given, and it is at the moment mostly around clarification. But we're also getting a lot of frontline organisations. We've got a great network of people who use our calculator who just worked with us through data analysis of all sorts. who are feeding in anything they've just heard, so we can find out a bit more from DWP or HMRC. So, and the changes are made immediately. If we know something is a definite change, or we hear that it might be changed, that's going onto the website. The calculator is changed overnight with regulations. It's always up to date. So if you were to go on the calculator now, you'll see all the new benefit levels in there if you're using that to support people. If we've missed anything, do let us know. We try not to let anything slip through the net, but there's so much change at the moment. As far as we know, it's always up to date.
Brilliant, thanks, Zoe. Another one, either for yourself or for Louise here, but it's from somebody that says, what if you're self-employed and now taking an employed job on a short-term contract whilst you can't do your self-employed job? Does this prevent you getting a grant or claiming UC? Any thoughts on that, Zoe, Louise?
I think that's an interesting one, isn't it? And we have seen that one before. One of the conditions of the self-employed grant is you are self-employed at the time you get the grant. I presume that will be a question on the online form. Are you still self-employed? I think as long as you're keeping your business open and continue trading, and you haven't shut down your self-employed work, so it's still there. You might be doing some employment as well, but your self-employed work's still continuing, and you meet the other conditions about 2018-19 tax year. At this stage, we can't see any reason why that person still cannot access the self-employed scheme. Of course, if they've shut down their self-employed trading, I think that they will not be able to answer that question and they won't be eligible.
Okay, great, thank you. Another question here around sanctions. There's been a number of different questions around sanctions, so I'll just pick this one. But somebody's asking, can we get more information around sanctions? All sanctions, are all sanctions suspended, or is it only open-ended sanctions? I have contrasting information about this from our local JC Plus.
Yeah, unfortunately, we have contrasting information as well. The DWP is saying it's not going to be introducing any new sanctions. Previous sanctions are ongoing. The line we're hearing is that they're trying to be flexible on them and not cause hardship, but of course sanctions always cause hardship. It's a really good question. We'll try and find out more, and anything we find out, we'll try and clarify on the website.
Brilliant, thanks, Zoe. And this is a little bit of a mean question, so thank you to the person that put it in, and for me for asking you, Zoe. How long do you think the additional supports are likely to stay in place?
It's difficult to tell, isn't it? I mean, who would want to be in the government at the moment, trying to weigh up economic impacts and benefit impacts and fairness? You know, having parallel benefit systems with different levels of support is going to eventually cause a lot of upset, one would imagine. But at the same time, you do need to support people to keep the economy going once this situation's over. There has been an indication that they will continue. I think it's all going to come down to how long they decide to keep people in isolation. My view is that they might well keep them on for the short term, just while people are in isolation, and lift it afterwards. Still waiting to hear. I'm not sure DWP are really set up for this to suddenly end after 3 months and deal with that new influx.
Thank you. A similar question here about, are you aware of any statements about whether the £20 increase in universal credit will remain after the pandemic, or if payments will revert to former levels? I think that's probably a similar answer to what you just said. Do you think, Zoe?
No, I think that's a bit more clear. The government's made clear that they are only for a year, from April 2020 to April 2021, that and the minimum income floor. I think they'll probably make another decision then about whether they'll continue them or not. It will depend on all sorts of economic factors. I mean, the problem we have with benefits, of course, and universal credit is the austerity measures introduced in response to the 2008 financial crisis are still in place. They haven't been lifted. So if additional austerity measures, or we make huge cutbacks in universal credit, we'll be adding austerity measures on top of austerity measures, because we never got out of the first ones. I think they'll have to make it. I think it'll depend on how many people are reliant on UC next April. The situation, the economic situation, so much to take into account. At the moment, I think they've covered themselves by saying they're lasting for only a year, but you know, as we've been saying throughout this webinar, this is such an unusual situation that they're so fluid. If we hear anything more, we'll put it on the website.
Great, thanks, Zoe. Another question here. Do you think the London waiting allowance would be included in the calculation for the job retention scheme?
Oh, interesting.
Stumped you on that one. Maybe if there's no immediate answer, we could come back to that person.
Yeah, I think that's what I'm going to have to look into and get back on.
Excellent. Okay, thank you very much. Just something about managing demand. A few people have talked about the demand that's coming through and basically managing demand. Is there anything that anybody wants to say there in terms of experiences that from our own clients, how our own clients are actually dealing with huge volumes, perhaps in terms of triaging? Maybe points a little bit to what you were saying, Peter, about the self-service bit on the calculator.
Yes, I got a question also about how quickly we can set that up. I think the calculator is a very useful way of doing some triage, but not every bit of triage. But certainly, it would allow you to start thinking about who is the most vulnerable and looking at it in individual circumstances. But if people are looking to say they want to use something like a calculator to understand the circumstances of households, but they can point them in the right direction for support, we can get that set up within hours of getting the get-go. So that's not a problem.
Lovely, thank you, Peter. A question here with the, and I'm not sure whether this is to yourself, Louise, or to Zoe, but with the million new universal credit claimants, have you heard if there's likely to be any delay in DWP making advance payments or making the first UC payments? Some people at food banks have said they might be waiting longer than usual.
I think we heard sort of at least last week when sort of this was really at its peak. You know, the waiting lines to get through on the phone were very long. The website, I think, was, you know, the queues were hours and hours. I guess what we've heard now is that basically they're paying the advance in days and that they're starting the claim date on the day that the person makes their first kind of application online. So even if it takes a few days for the identity verification to go through, their claim will begin as soon as they've made that first application. So I think hopefully sort of what we're hearing, Zoe, I guess, I don't know if you've heard differently, that now they are sort of getting the payments pretty quickly, but I wouldn't be surprised if in some cases it's taking longer than usual just because of the huge demand.
Yeah, I would agree, Louise. I mean, it does seem like they are slowly getting on top of it. I think the main problem was the verification and any situation where people would have needed to take proof to a JCP and waiting for the so actually get enough to actually information to start saying the claim is live and paying that advance. And any of that information that used to be done in person, we're relying on, they're now relying on the DWP phoning people back on this. And that the delay in them doing so has definitely reduced. But I think for some people, even a short delay is actually really problematic, given for some people all income has stopped. I don't think that demand on food banks is going to stop. I don't think that demand on other services that, you know, emergency services to help people is going to stop. But it's certainly the DWP, we are seeing a change in that length of that delay.
Great, thanks, Zoe. A question here from somebody. Do you think there will be anything done about people missing the furlough cut-off date of 28th of February? We are seeing a lot of clients affected by this. Anything you've picked up there?
I'm not sure it's going to change. I think that my view on some of the answers that's coming out at the moment in clarification of some areas is that this is what we've done. A decision's been made, this is what we've done. And we've increased UC for those that it's not covered. I'm really not sure it's going to be a priority for the government to be looking at now. I think they feel that they've done enough to help enough people to allow enough businesses and the economy to keep going afterwards. And actually there is UC, they have increased UC for those that don't make it. There is a huge element, I mean, I completely see where the person who asked this question is coming from. If you're one of those who's fallen, you know, you just don't fit into those schemes, just because of one day or you didn't fill in your tax return, you're not going to get it in on time. This sort of stuff, it does start feeling very unfair. We're seeing an awful lot of that in our questions. And it's how sustainable that is. But at the moment, I'm seeing no movement on that at all. If anybody here is different, do let me know.
Great, lovely, thank you. Somebody here says, I have a question around the benefit cap. My understanding is that the benefit cap will not apply to people who have recently lost their job for a grace period of 39 weeks. Isn't that going to protect most people who are losing their job because of COVID-19?
Yeah, that's absolutely true. The example I gave was people who had started their jobs 6 months ago under UC. The grace period is based on 12 months if they've worked for the previous 12 months at 16 hours, equivalent of 16 hours on the minimum wage. And of course, that will protect an awful lot of people for the 9 months grace period. I think we might see a big influx in people being affected after 9 months. All depends on how the economy goes and how we all recover from this. But obviously, there's an awful lot of people who started their jobs in the last year. A lot of people who went back to work because their children reached school age. An awful lot of people that grace period won't apply to. So although it won't be, there is protection for, I would say, probably the majority coming over to universal credit. Their first experience of the benefit system, they may well be shielded from it. I do think that we're going to, somewhere down the line, this is going to come into play for many of these people.
Great, thanks, Zoe. I'm rattling through these questions here, so I'm going to take about maybe 3 or 4 more. How can phone UC claimants update their status, given that the phone lines are so busy? I think this points to the graphic that you showed, Zoe, about the amazing increase in UC claimants and how DWP are coping with that. Any advice on this question?
The only advice I can give is that people stay on those phone lines. As I said, someone I personally advised had to hold the line for 7 hours. I mean, they went out walking with the phone. They did their household chores with the phone. It is a very, very tricky situation for those who are not doing online claims but doing phone claims, so they don't have the journal. I absolutely agree. I think DWP, what has been remarkable in this is the amount of flexibility and understanding DWP have shown. They're not in a position of, at the moment, they are really in a position of wanting to make sure that these claims get updated and people get supported as quickly as possible. And I think this level of flexibility is quite extraordinary. And I do feel that if somebody can't get through, they will take that into account. They're trying to take all these things into account. And I think we've got to put aside our previous experience of DWP sticking rigidly to the rules. I think there is a new sort of approach at the moment.
Okay, great, thank you. A very quick question here about what about limited company directors? Where do they go? Are they self-employed?
I'll leave this to Louise because we've had a lot of questions about this one.
Yeah, so it basically, with these ones, it is a bit tricky. As Zoe mentioned, if they pay themselves through PAYE, then they can basically sign themselves up for the job retention scheme, so treat themselves as an employee and get the 80% of their wages up to the 2,500 cap that way. If not, then they kind of need to look into whether they then fit the criteria for the self-employed scheme. So, you know, if they've submitted their tax return and all the other kind of points that they need to tick. But then there will be some people who, I think the big one is if they paid themselves through like dividends, who basically won't be eligible, or there will be people who maybe pay themselves a very small wage through PAYE, who'll get 80% of that paid, but won't get, you know, the bulk of their income paid. So really it will kind of depend on their exact circumstances, but so basically kind of it could be either of these. Just need to look into the technicalities.
Great, thanks, Louise.
And it does mean that some people do fall through the gaps. I mean, one of the queries I remember seeing was from a chap who had a scrap metal business, and he had been advised by his accountant last year to move to a limited company, paid himself very little through PAYE, obviously, because then you shield yourself from the national insurance costs. So paid himself very little, but if he had been trading for 10 years just as a sole trader, self-employed, if he'd maintained that status, he would have gotten a lot more assistance. So a lot of it's chance. How, you know, a lot of people who've set up as self-employed, they can choose whether to go as a limited company, or they can choose whether to be partnership, or sole trader. and where they made those decisions, and then whether they made the decisions, how much they paid themselves through PAYE has an impact on this. So it's a lot of past decisions coming back to haunt people on this, I think.
Okay, I'm just going to take 2 more questions because I know that we are 20 minutes over, but I see a huge number of you are still on the webinar, so thank you very much for staying with us. But just 2 more questions and then we'll need to draw it to a close. With the DWP suspending overpayment recovery, does this apply to someone claiming legacy benefits like JSA as well as UC? But will it not include suspending debt payments for someone on a HMRC benefit such as tax credits?
I think they're absolutely right. I mean, the DWP have said that the local authorities they're not taking any more referrals from local authorities on HB overpayments, and they're not taking any more referrals from HMRC on tax credits. Ongoing ones, I think the indication they've given is that they are going to stop recovering from both older and new benefits. Obviously, a lot of people, especially people who have are paying these back by direct debit rather than through benefits, need to stop those direct debits. I think we're needing more clarification. An awful lot of the information on this actually has come through partnership managers talking to their local contacts. I think it would be useful if DWP could give us a lot more information on this. I will be keeping an eye out. It's something I've been trying to get hold of at the moment, and as soon as I do, I will update the website.
Brilliant, thanks Zoe. And I'm just going to leave a final one for those people whose questions I haven't got to in this session now. Please be assured that we will take all these questions and we will get back in touch with you with specific answers. There are quite a lot of questions, as you can imagine, with the number of people on the call, so we will get back to you after the webinar. A few people asking about the slides and the recording, they will be sent to you automatically as well. But just before and this is, I think, probably a question for you, Peter, from one of our clients. Lovely to see you, thank you, on the webinar. Can you advise on what we need to know to be able to use our policy and practice calculator when advising from home, or are we limited to one that's just available to the public, to the free calculator? And Peter, do you want to take that question?
Yeah, very simply, we have a number of versions of the calculator. We've got the free calculator, which is on our website or on .gov.uk. We've got the self-serve calculator that would hook up to advisors' version of the calculator, which is slightly more functionally rich and provides an awful lot more support for advisors. And if that is something that is of interest to people, then we certainly would love to have the conversation with you. Just let us know and we'll give you all the details in terms of, obviously it is something we sell, not hugely expensive, but it is something we sell to advisors, and we'd love to set you up with that. And an awful lot of people are able to work from home using it. It's a cloud-based solution, and therefore it works very well for people from home, and you can still work within your teams, so you can share calculations within your own organization to do that. So that works very well for people in the current circumstances.
Brilliant, thanks Peter. As you can see on your screen, I've moved on to this slide here, and it just points a little bit to what Peter's just talked about, but this is about supportive tools that can help you in this situation. So you'll have heard us talk a lot today about this web page that we've set up. It is updated constantly, as Zoe and Louise have both mentioned. There is the URL there. Please feel free to link to it from your own websites, your own Facebook pages, whatever your communication channels are, to your own clients and customers. And yeah, I mean, you know, lean on us and we will get that welfare advice up to date all the time. You can use that link there. Peter just mentioned there, our basic benefits calculator is listed on gov.uk and it is free. Again, please absolutely feel free to use that far and wide with your own contacts. It doesn't necessarily have the built-in features to help frontline advisors that we've talked about today, but it is accurate and it is very simple to use, and the links will be provided to you afterwards as well. We talked about, if you do have our calculator, we talked about the self-service calculator that helps you to triage customer support as well. Very useful for the policy and practice clients that use our calculator. Just shortly after the webinar right now, when I close this webinar, there will be a very short survey. We'd really appreciate your help and your feedback, and there's an opportunity there for you to answer more policy questions as hard as you want. Now we're off air, but anything that is or even just give us your feedback and your views. If you think we've got something wrong, or you think we've just not covered something, we've missed something, please do help us, because we want to help you and everybody else. We do have another webinar coming up in a couple of weeks' time, and we're going to be, again, sticking with coronavirus, as you would expect, and bringing out some stories from the front line. So please, the chance you can pre-register for that webinar in the follow-up survey as well. So I am now going to hand back to say to Zoe, I think, to say just to thank everybody for the webinar. Over to you, Zoe, for final words.
Yeah, thank you all for attending. I do know we're very busy. You must be even more busy because you've got millions of, it literally is millions of people who are needing your support. I can't imagine what it's like working at a local authority or a housing association or citizens advice at the moment. Thank you for taking the time to go through all this with us today, and continue to share any understandings you have, anything you've heard. Continue to share it with us. Let's all share as much information as we have, because I think all of us are facing the same thing, trying to help people, and the more we can share, the better. So thank you very much for attending.
Brilliant. That's great. Thank you very much, Zoe. Thanks, everybody, and I hope to see you on a Policy and Practice webinar again soon. Take care. See you later. Bye-bye.